As a rehab nurse for the last over 20 years, and as a support group leader, many times we have a lot of different topics that we use to teach the support group members. And one of the most requested topics that I have is medications. Many people after a brain injury are on a number of medications that they weren't on before. And a lot of them have a lot of questions because and I'm here with Maurice Harris, who's a member of our support group here, and you've also a board member of the Brain Injury Association. Yeah. And we're really happy that he's here. But he had a few questions about his medications. And Maurice, you remember when I was your nurse,
yes,
way back when, and your injury was when?
Christmas Eve, 6 years ago.
Okay, it's a few years ago. And you were, at the time when you were discharged, you were on a lot of medications when
yes.
you came home. How did you feel about that with all those medications? You had a lot to deal with. But
well, basically, I was confused about the medication. I was told to take several medications that I didn't know which one to take and when to take it.
So I think, and even for people that do not have a brain injury or any kind of memory issues, I think it's really important to figure out a way that how am I going to remember to take my medications? Because the number one thing is to know your medications. And just when I was asking him again today, now you're only on what?
Blood pressure pills at the moment. And I also take sleeping pills also.
You take sleeping pills also. Okay. So you have two things you take now, and the name of your medication is?
You said you didn't. Denergy or something like that.
I think you said you didn't really remember.
Right.
So, but one thing that, it's okay because he takes only one medication, but in order to remember, even if you're taking one medication, a lot of times the names are really difficult for anybody to remember, is to just jot it down on a little card or something small that you can carry in your wallet or your purse. And
right.
Maybe we can do that once we find out exactly what the medication is, and so you can carry it with you because you never know when you may, need to know what
right.
that is. Knowing your medications is really important. The name of them, also when to take them. So we just talked a little bit about when, how to remember when to take these and what kinds of things you can do. The pill boxes. I use one for my medication, and it's really helpful. So even if you don't have any memory issues, sometimes you can forget. But also, you need to know, too, one thing that's really important is knowing the side effects. And
right.
we had talked a little bit, and were you familiar with some of the side effects of your blood pressure medication?
Yes. First of all, I shakes a lot if I don't take my blood pressure medication. Okay. And it's just, I also forget things a lot also because my blood pressure medication really affects me a lot if I don't take it.
Right, if you don't take it. And so your symptoms, you've discussed those with your doctor, and,
yes.
and you feel free talking to your doctor
yes,
about that. It's really important to know that you can call your doctor's office if you don't know the side effects. Usually with your the patient insert on your medications, there's this big long thing and you can read it forever and ever. And sometimes it's very difficult. Oftentimes it's difficult to understand. What you need to do is just ask your doctor when you're there, or you can ask the nurse. At most doctors' offices, you can just ask to speak to the nurse, and she'll be able, he or she'll be able to go over that with you. Or even ask the pharmacist. And I know, Maurice, a few times you said the pharmacist at your pharmacy has been very helpful.
Yes, because I call them a lot because I have a tendency to forget a lot when to take my medication and how to take it and what time to take it. So I usually call them a lot. I might frustrate them, but I need to know about my medication. Well,
I don't think you're frustrating them, so I think that's good. And I think it's a good thing that as a patient you have. That's a right that you have, and any healthcare provider is really happy to talk to you about that. The other thing too is to take it as prescribed. A lot of medications need to be taken on an empty stomach or with food, and there's a reason for that. I know that in our last the support group that we had where we talked about medications, somebody said, "Well, I just take them all at once, and I take them as soon as I get up, and without regard to whether." There's food or not, but sometimes medications can cause some stomach upset, and sometimes they're more readily absorbed with food, so it's really important to know how to take your medications, and those package inserts or your physician will tell you if you need to pay attention to how you take that, with food, without food. Some medications need to be taken with a full glass of water, and again, there's a reason for that. So it's to better absorb it or to minimize the risk of side effects of that medication. I remember one time you had asked me about cutting your medication.
Yes.
And that's why I'd asked Mauricio.
Yes.
Okay, that was a really important one, especially in this day and age when you know, money is really tight, and people who are on a lot of medications, maybe it'd be somebody who's on a limited income or on disability, they're always looking to save money. When you're on your medications and you are trying to save money, that is not the place to save the money. And cutting your medications in half to make them last twice as long is never a good thing. And why is because that dose of medication has been really carefully prescribed to the patient, just like your doctor took into account your past medical history, what had happened to you, your height, your weight, and all that to prescribe a particular medication. So that is the dose that's required to get the effect, which is to lower your blood pressure.
Right.
And cutting your medication in half is not going to achieve that effect. It would be almost like it wouldn't be nearly as effective, and it's really important not to do that. Another thing is that some medications are time-released, and some medications really are ineffective if they're cut in half. So, especially with the time-released, if you cut it in half, it's not going to be absorbed, you know, as well or anything. So, never cut your medications in half unless you are told to by the doctor. There are some that you know, maybe only come in a certain dose and your doctor wants you to cut them in half. He or she will tell you specifically to do that.